Welcome back to Quick Hits. I'm your host, Tyler Smith, and joining me behind the mic today for this episode is a special guest co-host, Maroussia Petryk, account manager here at Health Data Movers. Today's guest leads digital and technology strategy at one of the largest and most advanced cancer research and treatment organizations in the country. Simon Nazarian is the System EVP and Chief Digital and Technology Officer at City of Hope. His career spans healthcare, consulting, and large-scale organizations across multiple industries, including leadership at Kaiser Permanente, before bringing those lessons to a mission-driven environment where care, research, and innovation intersect. In this episode, we get into what it takes to treat data as a true strategic asset and why Simon views data migration as clinical and operational infrastructure, not just an IT exercise. We also dig into Hope LLM, City of Hope's proprietary generative AI platform that synthesizes thousands of pages of oncology records into clinician-ready insights, giving physicians back their pajama time. Simon shares his framework for AI readiness, why governance enables innovation rather than slowing it down, and how he thinks about ROI alongside what he calls return on opportunity. This is a conversation with someone who believes innovation done well is invisible and that the best technology in healthcare still comes down to holding the patient's hand. Let's jump in. Welcome back to Quick Hits, where we bring you quick, impactful conversations with leaders shaping the future of healthcare IT. At Health Data Movers, our mission is to empower patients and providers by unleashing the potential of healthcare data and technology. So we're always excited to explore how that's coming to life inside leading health systems. Today, we're joined by Simon Nazarian, System EVP and Chief Digital and Technology Officer at City of Hope. Simon, welcome to the show.
Thanks for having me, Tyler.
So before we jump in, can you walk us through your background and the path that brought you to your role as Chief Digital and Technology Officer at City of Hope?
Be happy to. Let's see, my career has been shaped across healthcare, consulting, and other large-scale organizations across multiple industries. But, always with a consistent focus on how technology changes behavior and outcomes at scale. What is the problem we're trying to solve? And that kind of experience is reinforced for me that technology only creates value when it's embedded into real work, right? It has to be supported by governance and adopted by this folks that are closest to the problem. I moved fully into healthcare in 2008 when I joined Kaiser Permanente and stayed, because of the direct human impact technology can have, when it's done well and really being able to feel and see the folks that you're impacting firsthand has been a wonderful experience. And I joined City of Hope, to apply those lessons in a very much of a mission-driven environment where care, research, and innovation intersect together. And for those of you who may not know City of Hope, we are one of the largest and most advanced cancer research and treatment organizations in the U.S. And our research has contributed to groundbreaking treatments for cancer, HIV, diabetes, sickle cell disease, and other life-threatening diseases that are out there. We have also an unparalleled, really national clinical trials model that is redefining how patients access these leading edge cancer care because of our nationwide presence. We're able to come to you, and we're within driving distance of 86 million Americans today. And we have we have hospitals and outpatient sites in a lot of metropolitan areas in Southern California, Arizona, Illinois, and Georgia, and that makes us fairly accessible to to the folks out there. And my role at City of Hope is really enterprise wide. So I'm accountable for not only digital and technology that goes along with it, but also over our overall enterprise platforms that support care, across our overall system. And I consider myself a business executive with a good technology acumen, because the job is as much operational as it is technical, and staying close to the frontline reality, and really helping create the vision and quarterbacking execution. By aligning the right talent to the right priorities, so that we can move innovation from idea to adoption in a real critical work environment. And I'll share with you more on what that really means. And I consider the role, it's less about tools and more about building really durable digital data capabilities that can scale responsibly across a national care system, and across our overall healthcare ecosystem, within the country.
Thank you so much, Simon. Good segue. City of Hope sits at a rare intersection of clinical care, cutting edge research, and innovation. How does that unique environment shape your approach to digital and technology strategy?
Well, great question. Cancer care is very longitudinal. It's complex and it's deeply human, right? It can't be just approached as a transactional experience. Imagine you hear those three little words, you know, you have cancer, right? And you have to be really cognizant of that. And as our CEO Robert Stone says, the hardest, or even harder than that, is when you have to tell people, I have cancer, right? So, our structure really allows us to, take research insights and move directly into a clinical setting. And that raises the bar for how technology supports decision making within our organization. So, technology strategy not only must, simultaneously support clinicians and delivering care, but helping researchers advance their discovery, right, and helping patients navigate a very overwhelming journey. And we pride ourselves, from going to bedside to bench, back to bedside, and being to provide that level of advancement in solutioning, right? And because we have a national footprint, that it creates both scale and complexity, that our platforms are not point solutions. And so, the way I describe it is that our strategy is grounded in whole person care, right? You want to improve outcomes while reducing friction for patients and clinicians to do the work, and be at the forefront of emerging and leading edge technologies as much as possible.
Absolutely. Thank you. How do you think about data as a strategic asset at City of Hope? And what does it take to actually realize that potential?
Oh, let's see. Well, data is, how do I say this? Data is only a strategic asset when it's trusted, it's usable and available at the moment of decision, right? And I'm not, that's something that, everybody can tell you. But oncology data is uniquely complex, often spanning decades, multiple institutions, unstructured records, narrative documentation, and folks usually are referred to us. They come in with 3,000 plus pages of all of these, right? So we really have focused on structuring and integrating this data so it can support care delivery research and clinical trials. It's not just for reporting. And this work really laid the foundation of. I'm sure you don't. I'm not sure if you've heard of Hope LLM, which is our proprietary generative AI platform that leverages all of our extensive oncology data and expertise to reduce the administrative burden. For not only for new patients onboarding, I imagine having to tell the same story over and over again. We definitely want to get away from that. Better matching patients to clinical trials at the point of care, because when you show we can have a good idea of where we can do, and and really enable and expedite breakthrough research, right? And we've created our environment and designed it specifically so that we can synthesize large volumes of oncology records into clinician ready summaries and insights, right? And what that means is that our clinicians call it pajama time, right? The 3 hours they don't have to spend the night before, being ready, and they can do that in a very quick manner, is something that we get accolades for all the time, right? But from a technology perspective, also you got to be cognizant of the fact that data strategy is very much inseparable from governance. If you trust and explainability as prerequisites for adoption are not there, then it's not going to give you the outcomes that you want. So that's our point of view overall, is building that longitudinal multimodal view of a patient over a period of time, and making sure that we put it to good work across not only care delivery but also our research, and continuously close that loop.
And speaking of the value of data, especially given data migrations that you all have gone through recently, I know organizations treat the data migration as a technical checkbox, but for others, they treat it much more strategically because it does carry clinical and operational weight. How do you ensure that data migration is treated as a strategic initiative and not just another project?
Oh, fantastic question. This is really an important one, because migration, for us is treated as a clinical and operational infrastructure. It's not an IT exercise, right? These decisions directly affect our patient safety, research continuity, and all of the future analytics capability that we go after. So, we make sure that the choices made during these migrations, are done well, because they shape what is possible with AI, analytics, and interoperability later as well. So that for us, this is meant, prioritizing data quality, standardization, longitudinal continuity of all of this is, just got to keep that provenance in front of your mind. And a successful migration really reduces downstream complexity, and enables platforms like our Hope LLM to operate reliably at scale. That's really important for us. And partnering with our operational teams is important, because once we are moving it, we just acquired another organization in Arizona, right? Making sure that it comes over, we partner with our operations teams to make sure that everything is in place the right way before we introduce it even into our new systems.
Yeah, fantastic. So it does sound like you all understand the value of the different stakeholders that are not just IT, but the clinical and operational being brought together. And really cool to also hear how you're leveraging, parts of that activity to then feed data into the Hope LLM. Um, when it does break down, and not saying that it has, but if it has in the past, where does execution break down during this process, or this large scale initiative?
Oh, really fantastic question. Uh, we bring all of these pieces together. We talk about it, but with the clinical and operational problem, right? We want to understand, what is the problem you're trying to solve. If you know the problem you're trying to solve, you're halfway there, right? And the tools must fit into an existing workflow and reflect how clinicians, reason under pressure, right? So governance, engineering, and change management, have to be designed together and not sequenced. And with everything we do, this is not something that you sprinkle on or you bolt on. It's got to be structurally built in. So, and when you get to a point that sometimes you see friction, that's signaling early failure, right? Extra logins, manual reentry, black box situations, right? These are early signs, and you know these sort of drive the bypassing of the behavior, which you don't want. So adoption for us is really the test, repeated usage versus bypassing it, flags for improvement versus abandonment. We go after making sure that we get the net promoter scores, that we stay close to the users and listen carefully and have the necessary agile capabilities to iteratively improve as they partner with us. And clinician partnership also, from design through validation, is an essential part of a digital transformation, because, trust and sustained use comes from ownership. And when they're involved early, it helps us avoid the breakdown that you're talking to. That's our model. Just try to avoid it and fail fast.
Let's take a quick break to talk about something we know a lot about at Health Data Movers: data migration. Every merger, every EHR consolidation, every legacy retirement is an opportunity. An opportunity to bring your patient's story forward, complete and intact, and to build the clean data foundation that powers everything from day one clinical trust to your future analytics and AI strategy. That's exactly what Data Bridges was built to do. Data Bridges is our productized data migration framework, and it works in 4 phases: define, prove, execute, and stabilize. Along the way, confidence gates give you progressive validation checkpoints so your team knows exactly where the data stands at every step of the journey. What does that deliver? Confidence in your data, a controlled cutover, continuity for your patients and clinicians, and a go live that cuts the chaos. One academic health system used data bridges to bring 3 legacy systems into a single Epic environment with a post-live issue rate under 0.3%. Learn more at healthdatamovers.com or reach out to our team directly. Now, back to the conversation.
AI is dominating just about every conversation in healthcare right now. What does being AI ready mean to City of Hope, and what foundational work still needs to happen to get there?
Oh man, I've been, to a lot of conferences, been speaking, and you're right. Everything is about AI, and I got to be straightforward. AI ready is not, just that we have a model. It's not right. We have, gotten to the point that, at City of Hope, number one, by starting with structured and high quality data, right? Garbage in, garbage out. You want to make sure you deal with that. Having governance, right, that's designed into the architecture from the onset rather than, applied after deployment. You've heard me say that, I just said that as well. No sprinkle or bolt on, build it structurally within it. And then you have to focus on transparency and explainability at the point of care. This is not just buried documentation. It's important, to continually build trust by doing that, right? And what happens is, when you have a tech forward mindset across the entire organization, then, you're one step ahead, right? But also, this really required new ways of working, right? New decision-making norms, cultural adoption, then it's an ongoing process. Just think about your corporate governance today. Now you bring in AI and AI governance that is added on top of it as well. And you have to make sure that these things are aligned and collectively work together: your security posture, your data posture, your AI posture, along with your corporate governance. So we've really attacked it at that level. And we've also kept adoption in mind and change management in mind for through all of this, because this is a structural fundamental difference in the way difference that folks work. Imagine you're a researcher, putting ourselves in the point of view. 3 years from now, you show up into your wet lab, you turn on the light. What do you do next? What are you doing today? And 3 years from now, because of AI, is going to be completely different. So how do we work to create and bring along our researchers to be able to adopt these new technologies? And also, innovation is federated, listening to them, bringing it all of it. So we try to stay, close together and really stay tech forward.
Absolutely. Where do you think organizations might be overestimating AI today? And is there any place that you think they might be underestimating the groundwork it takes to make it work?
A continuation of what just we were talking about, your model capability, you're overestimating if you think model capability as the main barrier, you know, when workflow fit, trust, and adoption are usually the real constraints for, when introducing AI or any emerging technology, right? Speed has value. Speed matters only, when you have accuracy, validation, transparency, and accountability are designed in. We are in healthcare. We are dealing with people's lives. So we have to be very, very cognizant, on not overestimating and just putting in model after model,
Yeah.
right? Another interesting part for me is, the board mandates AI. So the leader of the organization says AI, AI, and all of a sudden you have pop up of pilots all over that are not related to one another and they're not scaling. Whereas if you go about it the right way, you have the right strategy underlying that has you implement AI within the workflows and you're close to it, you now have a scaled environment that actually has ROI as opposed to not. Now, on the opposite side that you asked is around the underestimation, right? Governance as compliance instead of safety engineering, right? It's something that you got to be super careful, especially in healthcare, right? You need to plan for scale where small risks multiply quickly without, embedded controls into the systems. And change management, we talked about it. That's really required to move from a pilot to durable use. And our success depends on champions and cultural adoption, right? And working with them, bringing them closer to those champions at the onset is important. You can't underestimate that value, and you cannot also underestimate how quickly trust breaks. When technology is adding steps or ambiguity or, noise that, that would cause the clinicians to just bypass and that way your patients never see the benefit. And, I always say that innovation when done well is invisible. And this is the case where we really want to be able to, you know, implement it in a way that we are not underestimating all the aspects of groundbreaking technology being deployed into our organization.
That honestly answers a lot of the question I was about to ask, and in a good way, because now I want to dig in a little bit more on what you said earlier around how you're at the intersection of IT, clinical, but also you have a business mindset. And you mentioned ROI. So, how do you think through ROI? And I think that's another buzzword that's been coming up more and more along
Mm-hmm.
with AI recently, and would love to hear how you balance innovation, patient care, and also hitting some type of ROI metrics.
Yeah, thank you. I mean, it's ROI and also return on opportunity, right? Is I think we kind of think about those hand in hand. That there's certain things just got to be done, right? Came a time that you had to deploy your EMR, or you'd just be, far, far behind. But the way we look at it is that number one, stability and safety are non-negotiables in healthcare, right? So are you compromising those? That in itself is a positive ROI if you're introducing new things and you're stable and safe as you go through, right? And then also innovation advances, when your infrastructure governance and validations are strong, right? So you can't start building all of these things if your infrastructure is, end of service life. You don't have the ability to scale, infrastructure in the cloud as you need it, right? So those fundamentals are really, really important parts of the ROI, because if you want to do it right, you got to make sure your fundamentals are taken care of, as well. And when we work through Hope LLM, which kind of reflected this balance for us, it's really supporting by synthesizing information while humans, remain in the final decision maker by design, right? Because that's where the ROI comes in. You are implementing information in the hands of the physicians at the time that they need it. So that translates into lower friction, continued adoption, being able to see more patients, and really improving the efficacy of the care that you're providing because you have more information at your hands. Even a simple DAX, kind of a solution or ambient technology solution really helps go that way, but it needs to have a human in the middle at the end of the day. And then, again, I harp on governance too much, maybe, but to me, governance really enables innovation by defining the boundaries and the accountability. That comes really, really handy. And then trust from clinicians and patients. It is really what's allowing our innovation to scale sustainably. So a combination of real value dollars and and also clinician satisfaction and patient getting better faster with the right level of care, right?
All right. Thank
And
you.
there's one more thing I add on there is you know in the world of in our world you have operations layer, right? You have your rev cycle, uh, you have claims, you have that operational layer that you run your business on, and those show ROI very, very quickly, right? Because you're reducing number of staff, you figure out things are going better, faster, cheaper. Then you come to the second level after operations. Now you're in the world of clinical, right? And being able to really provide the right tools to your patients, to your clinicians, reducing pajama time, etc., ease of onboarding for your patients, etc. That has clear ROI. The tough part comes is, where the nirvana, where you want to be in an early detection mode and really be able to, catch things in stage one rather than stage three. Those are the ones that it's a return on opportunity as well as ROI more so because you're making the investment knowing that it will, come, but it also adds tremendous value to a patient when you are able to give them that ability to know earlier and deal with the problem earlier.
The shift into true preventative medicine. Thank you for that. And looking back at some of the most major initiatives you'd led, what is one thing you do differently to better support long-term analytics, research, or AI use cases down the road?
I think one of the things that I would do differently in this area is that continually bring in our physicians to the forefront as we are doing the work. I think that's really, really important. Our partnership is just can't be overlooked. And when we launched the Hope LLM last year, it was a big initiative for us, and it has multiple pieces to it, right? We talked about chart summarization and clinical trials matching, both ways, both at the point of care, but also if we want to start a trial, we can use Hope LLM to determine who in our cohort, is valuable. But it has natural language processing where our physicians can really engage with the clinical data at the point of care without having to go search for it. And, gives our researchers the opportunity to define cohorts of data, just by interacting with the system, right? It was really successful because we invested early yeah, and aggressively in structuring all of our unstructured data, right? It is the prerequisite for AI success to me, and especially in a referral heavy environment, right? And also, we started down the right path of governance, but we quickly really migrated to what I talked to you about around encoding governance into the architecture early, and and really, it's just really pushing on the post deployment policy interpretation that the physicians will put into place. So, lessons learned, make explainability real at the moment of decision. Because just publishing documentation alone does not build trust, right? It's really going past that. Learn to design for scale, just as a transformation problem. Again, you got to keep operating model, adoption behaviors, all of those things in mind. And when you're trying to go fast, you sometimes forget about those things. So definitely honed our skills and our thought process through that. And then this is one big one, is really keep frontline workflow as the test environment, and measure of success. Because if the adoption is sustainable, then you're seeing more and more. And so tune in to the early signs, of what's happening and keep a close eye on it. So lots of lesson learned to continually improve your partnership with the folks that you're trying to support and get them closer to you.
So you've done a great job of taking us through like lessons you've learned, also the initiatives that you all are working on. If we look 5 years out, which part of clinical care do you think will be most transformed, or parts of clinical care by innovation and technology?
Oh, wow. Let me think. Well, building AI is becoming increasingly easy, but controlling it is becoming increasingly difficult, right? So I think that you know, uh, and velocity of impact is increasing. So, what you used to take years to build, you can build in a fraction of time. Like quick integration into Epic is like 2 hours. Like, wow, that's great, you know. But what's exciting is really for us is really pushing that into the world of research and care. Now, um, I feel that within healthcare, we're going to see the most value from a blended intelligence model where machines are synthesizing and surfacing context, humans applying their judgment, their values, and their nuance at the point of care, right? And because AI is becoming sort of the core infrastructure rather than experimental capability. And the strategy I just spoke of to our leadership was that we are now creating the new operating system of the organization with technology and with AI. And it really is going to give us much better outcomes for patients at the earlier. But we have to also in as we move forward in the future, digital innovations role has to inform the human relationship at the center of care. It's one of those things that I just, you got to be able to hold the patient's hand. But to give the pure techie response would be, I think that in 3 to 5 years, we're going to continually see improvement in early diagnostics and early detection, advanced diagnostics and detection. I think is really going in that direction, and married with the right governance, it can really, really make a difference for our patients.
That's fantastic to hear. And we've also been lucky, in addition to working with you all, to work with plenty of specialty diagnostic and particularly in the cancer and in oncology. So really encouraging to hear that viewpoint. I guess I'll kick it over to Maroussia, who will send us through the lightning round.
Uh-oh.
Thank you so much, Simon. Now just a couple of more fun questions. What's the best piece of career advice that you've ever received?
Always do the right thing. Everything else works itself out.
I love that.
Yeah, that was, gotta give credit to when I started my career, I joined Accenture, and on my first project, young buck out of MBA writing strategy, and one of our senior partners, we were just hanging out, and it's like, because I was asking all kinds of questions, and that's what he told me. He said, the answer is always do the right thing. Everything else will work itself out. And I've always kept that near and dear to my heart.
I really love that. Thank you for sharing. And how do you stay current? Are you reading anything in particular? Do you listen to any podcasts?
All of the above. I set aside, Friday afternoons, about 2 to 3 hours to just catch up on reading, listening to podcasts when I go for walks, I'm working out, in the car, listening, and also connecting, right? Like-minded individuals, CIOs and CTOs across other healthcare systems. We, I have no qualms about reaching out, saying that, hey, here's a problem I'm trying to solve. What are you thinking? And they do the same. So just really, and then lastly is experimenting. We have created a very amazing lab system here where we have the ability to try different things and throw in, bleeding edge technology and see how it works. And also bringing the physicians and say, hey, I want you to tell this system exactly what you want to do. And let's see if it will do it, put together the agent for you, right? The different kinds of orchestration, just all of the above. I make a conscious effort on it every week. And that's one thing I don't compromise.
You're so right. The world of healthcare seems so big, but it really is so small, and it's so important to stay connected to your peers and colleagues in the industry.
Absolutely. And also watching other industries,
Hmm.
right? It's not just healthcare. I learn a lot from other industries as well. When it comes to security, financial services, they are just very much leaps and bounds are doing things, with Mythos coming forward and those kind of technologies. You really, really want to learn what's happening cross industry, right? So that we can, work together in that space. And, it's world of imaging when my background is also in entertainment, TV and motion pictures, right? When it comes to imaging, understanding how digital capabilities are continually evolving in that area is also really directly applicable to healthcare and advanced diagnostics with imaging, right? So it's a day-to-day thing for me, and I don't compromise it.
That brings us to just about the end of all of our questions. Thank you so much, Simon, and Tyler. I'll let you close it out.
Yeah, no, this has been a fantastic conversation. And I think there's so much more we could have talked about, but we do try to keep it relatively quick per our title. Thanks so much for walking us through, your career, City of Hope's major initiatives. Really cool to learn more about Hope LLM, but then also how you balance all the different stakeholders and take a really comprehensive approach. And then, yeah, using what you can learn from the other industries. Um, Obviously there's a lot in healthcare that we can kind of borrow from industries that maybe have been slightly forward, but then it also sounds like more and more today, with initiatives like Hope LLM, like healthcare might start being a trendsetter or maybe a fast follower at best. So Simon, thanks again for your time, and we really enjoyed this conversation, and hopefully we'll have you on again soon on Quick Hits.
Yeah, absolutely. Thank you, Tyler and Mauricio. Appreciate your time and look forward to seeing you soon.
Thanks.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on YouTube, Spotify, and Apple Podcasts. And don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.